Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good day. I'm from Unicel. Today I'm going to present to you about positive direct antibody test in hemodialysis patient. Okay, so firstly this will be my contents, which is what is direct antibody test, factors influencing DAT test to be carried out, indication of positive and negative DAT, what is hemodialysis, major parameters observed on hemodialysis patient, studied case, patient demographic and clinical background, laboratory findings, patient medications history, patient treatments, discussions, and conclusions. Firstly, what is direct antibody test? The direct antiglobulin test, also known as the direct Coombs test, is used primarily to help determine whether the cause of hemolytic anemia, a condition in which red blood cells are destroyed more quickly than they can be replaced, is due to antibodies attached to RBCs. This may occur in autoimmune related hemolytic anemias, which are caused by a person producing antibodies against their own RBC antigens. Examples of this includes autoimmune disorders such as systemic lupus erythematosus, malignant diseases such as lymphoma, and chronic lymphocytic leukemia, infections such as mycoplasma pneumonia, and of course, use of certain medications or drugs such as penicillin. A DAT can be used to help diagnose hemolytic
Yeah.
disease of the newborn due to an incompatibility between the blood types of a mother and baby. When a baby is born, the mother may be exposed to the foreign antigens on the baby's RBCs and may produce antibodies directed against the baby's RBC antigens. This may occur when an rhesus positive baby is born to an rhesus negative mother. Formerly, antibodies to the rhesus antigen were the most common cause of hemolytic disease of the newborn, but this condition is now rare due to preventive treatments given to the mother during and after each pregnancy. The most common cause of hemolytic disease of the newborn nowadays is an ABO incompatibility between a group O mother and her baby. This type of fetal maternal incompatibility is generally mild. A DAT may also be used to investigate a suspected transfusion reaction. If a person being given blood develops a fever or other significant symptoms suggesting a potential for a hemolytic transfusion reaction, a DAT is done to determine if the person has made an antibody that has attached to the transfused RBCs. If the antibody is found coating the RBCs, then the RBCs may be destroyed or be removed from circulation faster than normal. Next is factors influencing DAT test to be carried out. DAT test will be ordered by physicians when a patient undergoes hemolytic anemia and the healthcare providers wants to determine the cause. This particular test also will be done when there is signs of HDN. Symptoms may include few factors, which is pale appearance, jaundice, splenomegaly, swelling of the entire body, and breathing difficulty. This also includes when there are signs and symptoms of blood transfusion reactions, for examples, fever or chills, back pain, or hematuria. If positive due to a transfusion reaction, an infection or drug, it will remain positive for 48 hours to 3 months. If it is positive due to an autoimmune condition, it may be positive over a long period of time, or known as chronically. A negative DAT means that the antibodies are most likely not attached to RBCs and the signs and symptoms are due to another cause that requires further investigation. In this section, I'm going to explain about hemodialysis. Hemodialysis is a process of purifying the blood of a person whose kidneys are not working normally. This type of dialysis achieves the extracorporeal removal of waste products such as creatinine and urea and free water from the blood when the kidneys are in a state of kidney failure. Hemodialysis is one of the three renal replacement therapies. An alternative method for extracorporeal separation of blood components such as plasma or cells is apheresis. Hemodialysis can be an outpatient or inpatient therapy. Routine hemodialysis is conducted in a dialysis outpatient facility, either a purpose-built room in a hospital or a dedicated stand-alone clinic. Among the major parameters observed on hemodialysis patients are blood urea nitrogen, hemoglobin, iron and ferritin, albumin, potassium. Now I'm going to talk about the case study. Firstly is demographic data and history. The patient is a 51 years old female with demographic background of a Muslim religion and works as a businesswoman in Klang Valley. She have three siblings and two children and no previous medical history other than chronic renal failure. Her first episode encounter of renal failure when she did her first time renal checkup after suffering from frequent back pain, hematuria, decreased urine output, swelling on the lower part of leg, and fatigue. The medical checkup were done from the past 24 months at the same hospital and referred to a nephrologist DEMC specialist to perform hemodialysis. Hemodialysis were performed on the patient to lower the fatality risk due to chronic renal failure. During blood transfusions, procedure done to the patient, she suffered from few blood transfusion reactions such as fever, chills, and elevated hematuria level. Blood samples were sent to laboratory to determine whether she was suffering autoimmune antibody or other complications. Lab findings shows that the particular female patient not only having chronic renal failure but also positive direct antibody test. As suspected, a hemodialysis patient will have a high range number for urea, creatinine, and potassium, while for full blood count, the patient happens to be having a low hemoglobin, total RBC, and packed cell volume. After blood was transfused, the patient suffered transfusion reactions. As requested by physicians, blood bank analysis was done, and the results was positive for DAT. For the patient's treatments, physician had advised the patient to perform hemodialysis every 3 months as required to improve renal functions. Nephrologist also has prescribed the patient with drug medications such as erythropoietin, iron, active vitamin D, phosphorus binders, B complex vitamin, and folic acid, antihistamines, and also vitamin E. This particular patient were diagnosed with positive DAT test results. Physicians requested laboratory scientists to release all rhesus negative and perform cross-match tests on the donor packed cell as the patient received blood transfusions. To be discussed, the patient was diagnosed having chronic renal failure, hence causes the patient to undergo hemodialysis every 3 months. By monitoring urea, creatinine, potassium, hemoglobin, platelet, total white blood cell, enhances the efficacy of monitoring the improvement of patient renal function and full blood count current state. Lab tests were done not only at pre-hemodialysis but also done at post-hemodialysis. The patient low hemoglobin level and too high level of platelet, forcing the physicians to decide on performing blood transfusion on the patient to remove any complications, even though there will be risk of hemolytic anemia. Nevertheless, the patient blood group is B rhesus positive, showing no complications for general cross-matching procedure of blood transfusion. After blood was transfused, the patient developed several transfusion reactions causes her to have symptoms such as hematuria, back pain, chest pain, and high fever with severe chills. The blood transfusion reactions was reported directly to the laboratory department. Ad hoc investigation on her were done by laboratory scientists and was found that the patient shows positive results for direct antibody tests. New packed cells were requested to the National Blood Bank for blood group type O rhesus negative, as it is known as universal donor blood group with negative antigens on the red blood cells membranes. Post investigations and research proved that the patient does not develop autoimmune disorder after blood transfusions, but naturally, she was born with positive direct antibody. Further investigations and laboratory results on the patient's clinical background and antibodies was requested to remain confidential as requested by the patient. In conclusion, Chronic renal failure affects the patient's renal function, liver function, and full blood count result, and parameters such as urea, creatinine, potassium, hemoglobin, platelet, albumin, ALP, and GGT. Hemodialysis is a type of treatment widely used in medical field to treat this type of disorder. The uniqueness of this case study lies on the patient-positive DAT result, which forces physicians and laboratory scientists to conduct crucial and sensitive tests, as it may cause fatality if wrongly diagnosed or conducted. Blood group O with rhesus negative proved to be the universal donor, and less than 6% of worldwide population has this type of blood group. Lastly, this will be the references list for this case study. Well, last but not least, thank you so much. Bye bye.